Hello everyone, today we are going to discuss about the lumbar plexus. Lumbar plexus is one of the main nervous pathway which supply lower limb and it is formed in the substance of psoas major muscle. Lumbar plexus is formed by anterior primary rami of upper four lumbar spinal nerves. That means anterior primary rami of L1, L2, then L3 and L4. Here in this picture you can see this is the psoas minor muscle here. This is the psoas minor muscle and this is the psoas major muscle. So this is the nerves of the lumbar plexus. You can see here in this side those nerves emerge in the or formed in the substance of psoas major muscle. And the branches of the lumbar plexus emerge from the lateral and medial borders of the psoas major muscle as well as from its anterior surface. Now let's see what are the branches emerge from the lumbar plexus. Those are the iliohypogastric nerve. Here iliohypogastric nerve which is L1 nerve root. Then ilioinguinal nerve, it also has L1 nerve root. Then lateral cutaneous nerve of the thigh, it has L2 and L3. Here you can see lateral cutaneous nerve of the thigh is this one and it is formed by the branches coming from the L2 and L3. Then you have femoral nerve here. Here you can see it is a large nerve. The branches coming from the L2 nerve root here, L3 nerve root, then L4. Here this is the genitofemoral nerve. Here this is the genitofemoral nerve. You can see it is formed by L1 and L2. Here then obturator nerve. It is also formed by, here you can see L2, L3 and L4. The femoral nerve and here femoral nerve and obturator nerve are the principal branches of the lumbar plexus. Then we will discuss the nerves one by one. Here this is the iliohypogastric nerve and this is the ilioinguinal nerve. This is the iliohypogastric nerve, this is the ilioinguinal nerve. Here in this side, this is the iliohypogastric and then ilioinguinal nerve. These two nerves, iliohypogastric and ilioinguinal nerve, enter the lateral and anterior abdominal walls. Here you can see this is the lateral abdominal wall. This part is the lateral abdominal wall. This is the muscle transversus abdominis. Here then the anterior abdominal wall is you cannot see here, but you have to remember that this iliohypogastric and ilioinguinal nerves enter the lateral and anterior abdominal walls. Then the iliohypogastric nerve, this one, it supplies the skin of the lower part of the anterior abdominal wall. It supplies the lower part of the anterior abdominal wall and the inguinal nerve passes through the inguinal canal. Here, this inguinal nerve comes here and in this area there is inguinal canal, then ilioinguinal nerve pass through the inguinal canal. Here it comes like this to pass through the inguinal canal. And then it supplies the skin of the groin and scrotum or labia majora. Then ilioinguinal nerve supplies the skin of the groin and scrotum or labia majora. Then you have lateral cutaneous nerve of the thigh. Here, this one is the lateral cutaneous nerve of the thigh. You can see the nerve goes downwards and enter into the cutaneous, enter into the superficial fascia of the thigh. Here, this is the lateral cutaneous nerve of the thigh. In this side, this is the nerve. The nerve crosses the iliac fossa in front of the iliacus muscle and enter into the thigh behind the lateral end of the inguinal ligament. Here in this area there is inguinal ligament, although you cannot see it here. There is inguinal ligament. This lateral cutaneous nerve of the thigh enter into the thigh behind the lateral end of the inguinal ligament. And then it supplies the skin over the lateral surface of the thigh. Here, this part, it supplies to the lateral surface of the thigh. Then you have femoral nerve, which is the largest branch of the lumbar plexus. Here, this is the femoral nerve. You can see it is emerged from the lateral border of the psoas major muscle. Then, it runs downward and laterally between psoas and iliacus muscle and enter into the thigh behind the inguinal ligament. It also enter into the thigh behind the inguinal ligament and lateral to the femoral vessels. I discussed in my previous video the femoral triangle. Then you have learned the contents of the femoral triangle, and you can remember the femoral nerve lies lateral to the femoral vessels. This femoral nerve also supplies iliacus muscle as well as lower part of the abdomen as well. Then here you can see the obturator nerve. Here this is the obturator nerve. Obturator nerve emerge in the medial border of the psoas major muscle. In this side you cannot see obturator nerve. After removing the muscle, only you can see the obturator nerve like this. As you can see here, obturator nerve crosses pelvic brim. It crosses pelvic brim in front of the sacroiliac joint. Here in this area, the sacroiliac joint, it crosses in front of, it goes in front of the sacroiliac joint and behind the common iliac vessels as well. Then it leaves the pelvis by passing through the obturator foramen into the thigh. Then you have genitofemoral nerve. Here is the genitofemoral nerve, which has emerged from the anterior surface of the psoas major muscle. This genitofemoral nerve has emerged from the anterior surface of the genitofemoral nerve, anterior surface of the psoas major muscle, and it runs downward in front of the muscle. You can see it runs downward in front of the muscle and divides into two branches as femoral branch and genital branch. Here this is the genital branch, this is the femoral branch. This genital branch, it enters into the spermatic cord and supply cremaster muscle. Cremaster muscle and femoral branch supply small area of the skin of the thigh. This genitofemoral nerve is correlated with the cremasteric reflex. It is the clinical correlation of this genitofemoral nerve. The cremasteric reflex is when you stimulate the skin of the thigh in a male. When you stimulate the skin of the thigh, or imagine this area, a small area which supplies by the femoral branch. If you stimulate the skin of the thigh in a male, it results in reflex contraction of the cremasteric muscle, because you can see this genitofemoral nerve also give a genital branch and it supplies the cremasteric muscle. And the drawing upward of the testis within the scrotum. You can see the testis within the scrotum goes upward then due to the contraction of the cremasteric muscle, that is called as cremasteric reflex. So that's all about the lumbar plexus and its branches as well as its distribution. So thank you for watching.